So welcome everybody. What I'm going to show you is just talk about just a clinical case. So a fairly short presentation, really just focusing in on basically clinical techniques in a clinical case. So not a lot of evidence, not a lot of preamble. We'll just kind of get on with the case. And this is one of the cases I showed when I did a day with myself at the BDA down in London. So this first case is an interesting case to look at because I think tooth wear is challenging. However you look at tooth wear in terms of ceramics or composites, longevity can be challenging. So at the Teaching Institute, a lot of the teaching we do is the Bioclear technique for composites. And that involves the matrices, the particle abrasion, the heated injection molded technique. However, there are different ways of doing things. So on the courses that we run, this is one of the techniques we use, which is the matrix transfer technique. And if you do want to read up about this, if you're a member of the BDA or you go online, you should be able to get this article that's on there from 2023, which goes through this technique and it goes through Bioclears. But I think quite a good way of treating tooth wear is using a matrix transfer technique. So essentially what this involves is a diagnostic wax up. Now, this can be done by the laboratory. It can be done conventionally or it can be done digitally. I'm just going to show you conventional technique here because that's simpler in some respects. But if you're into digital, this can be done digitally by you in the lab as well, which does have cost savings. Then essentially, as you can see here, this is just a patient who was bothered by the wear on the lower incisors. He'd already had the upper arch rehabbed, but the canines and the posteriors were in reasonable condition. You can see that he's already got failing traditional composites on here. So he was looking at essentially trying to get a cosmetic rehab done of these, and also in some respects a protective rehab. So they could have been done with Bioclear, but there's no doubt the Bioclear on the lower incisors, the access is more tricky. And the gentleman has limited opening, he has quite a stiff lip. So we went for a matrix transfer technique on this. So how does it work? As you can see here, we get a diagnostic wax up done. And then you check the diagnostic wax up that is functionally and aesthetically okay. And then you have a matrix made. Now these matrix need to be relatively stiff. So you can either have a good quality Essex retainer made, or there are materials like Memosil and materials such as that, which are a little bit softer, and they can work fine as well. So your lab often will have their material of choice. So speak to your lab and see what they want to do. But basically, the matrix technique is a way of applying heated monolithic composite to the technique. So it's not that different from the Bioclear. It basically is just a different way of applying it. So, main things with this technique is your composite has to be heated. Now, what else could you use? It's more than acceptable to use flowable composite as well. If you're going to use flowable composite, the ones that I have experimented with in terms of flowable, Genial works well as a flowable composite. What also works well is the 3M composites as well, the flowable composites from 3M. These composites are higher filler load and they're kind of nano filled, so they're much better than the composites of old, but there's no doubt that the paste composites are more durable. But as a short-term option, flowable is fine. So you're going to get a heater that heats your composite up to about 68, 70 degrees. Now the trouble with that is you can't inject it into the stent like you can flowable. You've got to apply it into the stent and then the stent clicks on. And as you can see here, we cut an access hole in the top of the stent. So as you apply the stent, the excess flows out through the occlusal. You chop that off and then you do your final finishing. So it's a more rapid way of applying the composite than the Bioclear, although there is a reasonable tidy up with it. So how does it work clinically? Now, we teach this in more detail on our courses, but essentially all the old composite has to go. You don't want to be bonding to that. Then particle abrade, and I lecture a lot elsewhere on particle abrasion, so I'm not going to go into the details of that. Suffice to say that you're going to particle abrade it. You're then going to go belt and braces and etch it. Then, as you can see with the middle bottom slide, you then PTFE the adjacent teeth. You apply your bond onto the tooth. Now, generally, I'm going to be doing this with 3M products. So it's generally, if aesthetics hasn't had to be fantastic, I'll use the bulk fill. So I'll use the bulk fill 1 from 3M. You're going to put the PTFE tape on the adjacent teeth so the composite doesn't bond to those. You're then going to put the heated composite in your stent and then slowly apply the stent on so that the majority of the composite runs out, okay, through the stent. You could easily as well use the 3M Filtech Supreme here. So the bond I'm using is the Scotch-Bond Universal Plus adhesive. And then it's the bulk fill 1 or it's the Filtech Supreme that I'm going to use. That then clicks on and then you light cure it. Okay, now if you're going to use bulk fill, you can cure it you can use up to 4 or 5 millimeters. And the C factor isn't a consideration because you're wrapping it around. So it's quite a nice way to do it. There are stents you can use that do multiple teeth. The trouble with multiple teeth, it's a higher risk option. So if you don't get the stent down or the dividers in the stent move, you can have real problems with that. So this is a very good way of doing it, but a very low risk way of doing it. Then the stent comes off, then you would finish your composite with your standard protocols. So gross finishing, and then we would go in with a Bioclear finishing technique. So I think the matrix transfer technique is a nice way to do these cases. Okay, works very well on lower incisors. I think it's nice if you're finding that the Bioclear, for whatever reason, isn't for you. Doing these individual teeth with the bulk fill employs a lot of the Bioclear concepts, but with the laboratory making the wax up and the stent, although you can do this yourself, you can do your own digital wax up, 3D print it, make your own suck down stent. So it's a nice way of treating tooth wear, but it still gives you that strong, monolithic, strongly bonded composite. So thank you for your attention with this technique, and I hope that provides something for you to think about in terms of the matrix transfer technique. So thank you for your time.